So he's got quite a lot of back history, this poor little cat. He's now about 2 years old, and when our story starts, he presents with around about a 36-hour history of being off his food and lethargic, a little bit of watery eyes, a little bit of sneeze, a bit dehydrated, high temperature. Nothing else really very much on physical examination to draw attention to. And to be honest, his owner at this stage was not too worried. He's had episodes like this multiple times before with his cat flu, and they were not too concerned, but just wanted a bit of treatment. He presented to our first opinion team, and so he was given initial treatment, very sensible, broad spectrum antibiotic, some meloxicam to bring his fever down, and subcutaneous fluids because he was dehydrated and a bit off his food. And that seemed a perfectly reasonable approach. But as you might imagine, it doesn't end there, because he continued to have diarrhea. He continued to be quite lethargic, and then his owner started to notice that his urine in the litter tray was starting to go bright yellow, which was a new change that they hadn't been aware of before. You can imagine with all his back history, they're quite clued up, they're quite attentive to him. And so they brought him back in, and we ran a blood panel, and there you can see the blood panel. So I'll give you a moment to look at that. Throughout, when I put up blood results, I will highlight the things that are outside their reference ranges in a different colour. I'll warn you now, it doesn't necessarily mean I think it's a significant change, but anything that's outside of the reference range will be a different colour. So it'll just draw your attention to those areas. Okay, so what we see, obviously on the left-hand side of the screen as you look at it, what we see is that the total bilirubin is quite high at 49, but nothing else is showing outside its reference ranges. And then obviously we've got some white cell changes on the other side of the screen. So here's a conundrum then. Here is a cat who's presented, he's got bright yellow urine. His bilirubin is 49, but we said that on clinical examination there wasn't really anything very much to note except the dehydration and the fever. So did we not do a very good examination? Did we miss something? Should we have identified this on the physical examination? He's sort of on the cusp for where you would start to expect to see actual external signs of jaundice. But a kind of distinction that I think is quite helpful to keep in your head is that bilirubin in cats needs to go relatively high before we'll really start to see it in the skin, in the membranes, in the mouth. And the cutoff is around about 50 micromoles. So that is, about 10 times normal. And at that level, you would expect to see physical evidence of jaundice. Below that level, it may be above the reference range, but you're unlikely to see it in the cat. But you certainly will tend to start to see it in the urine, either on a dipstick or physically, as with this cat, his urine starts to look bright yellow. Cats have quite a high threshold for bilirubin, so if bilirubin is spilling into the urine, then it is high in the blood. So if you're picking it up on your dipstick or you're seeing that the urine looks bright yellow, even if the cat doesn't look yellow, we should definitely follow that up. Why am I drawing this to your attention, this distinction between physical evidence of jaundice that we can see and a level of raised bilirubin that we can only identify on the blood panel? Well, I'm raising it because I think it's quite a useful distinction to keep in your mind, because it actually has quite a bearing on the kind of conditions that we think are more or less likely in terms of differentials when we start to think about what might be going on in the cat.